It's the top of the hour here. I'd like to say good morning, good evening to all our participants from across the world, and welcome to our GlomCon transplant session today. It gives me a great pleasure to welcome our speaker today, Dr. Tatsuo Kawai, who will talk to us about kidney allograft tolerance. Are we close to prime time? Dr. Kawai is probably the first surgeon we host over the last 2 years at the GlomCon conference. So we really welcome you among us, and we are looking forward for your talk.
Thank you, Kassem. And thank you for giving me an opportunity to talk about transplant tolerance in kidney transplantation, which is a holy grail of the organ transplant. Hope I can convince you that kidney transplant tolerance is actually close to a prime time and will change the landscape in kidney transplant. This is disclosure. So some of you may have read this article published in New York Times in April this year. She had 2 heart transplants and was found to have advanced lung cancer as a result of long-term immunosuppressive medication. She says, over the last almost 4 decades, a toxic triad of immunosuppressive medicines has remained essentially the same. These transplant drugs cause secondary diseases and dangerous conditions, including blah, 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 and serious infections and cancers. Patients like me need to speak up. Transplant without immunosuppression is desperately needed. After publishing this article, unfortunately, the patient died at age 59 due to advanced lung cancer. So as you know, we have many side effects associated with immunosuppressive medications, like infection. During COVID-19 pandemic, we lost many transplant patients. And at that time, over 10% mortality, and sometimes over 40% mortality was reported in the kidney transplant recipients. Cardiovascular disease is also a serious complication of immunosuppressive medications, and they can also develop de novo diabetes and hyperlipidemia and neurotoxicity. And CNI cause nephrotoxicities, and steroids cause osteoporosis and malignancies also. Of course, is most important side effects to we always have to watch whether they don't develop malignancies. So we usually take medications expecting some those drugs we're taking are good for our health, but immunosuppressive medication is totally different. They have to take those medications just to prevent rejection. So it is understandable many transplant patients are so depressive and become non-compliant. You cannot blame them. So this is looking at results of organ transplant of deceased donor. So we have results of kidney, pancreas, intestine, lung, and heart, liver. So kidney is about a 10-year survival of deceased donor transplant is about 50%. However, half of these graft loss is due to death with functioning kidney. So even in a living donor kidney transplant, half-life of kidney is about between 12 years to 14 years. And it's not even a living donor transplant. We still have to make